Okay, awesome bio kids. Here we go for the next video. This one is going to be the circulatory and respiratory systems. Okay, circulatory and respiratory systems, so make sure you look at your rat packet and you're ready to go. I'm going to use both rats I have in my pan just to give you a different perspective of colors. You don't necessarily want to memorize colors because some rats, they show up differently. All right, so we're going to start with the trachea. Okay, this is the trachea right here. I'm going to pull it up so you can see. You can see the white rings if you look closely. Okay, those white rings are known as bands of cartilage, and that helps to keep the trachea open. It prevents it from collapsing, because if you took those bands of cartilage out, all the trachea is epithelial tissue, which is skin. Okay, prior to that though, I just thought this was fun because these are good rats. You can see this widened part right here. That is the larynx. That's the voice box. There's bands of connective tissue in there to provide you with a voice. So the pathway of air is going to start nose or nasal passages as well as mouth, and it's going to go past the throat, called the pharynx, same place that food is going to go. The difference is it's then going to enter the larynx. Okay, so you remember there's an epiglottis in there that is at the top of the larynx that whenever you're eating is going to snap shut to prevent you from choking. So when you breathe, you want that epiglottis to be open, and air is going to go nasal passages, mouth, pharynx, larynx, down the trachea. Okay, now the trachea, when it gets down to the lungs, and these are the lungs right here, these feathery things on the side of the heart, and these feathery things over here, when it gets down, it's going to branch into bronchi. I'm not going to pin that because you'd have to really like take the heart out, and I don't want to do that. If we were in the classroom, I'd have 1 or 2 groups do it so we could see. But the trachea just basically branches into a right lung. This is the right side because this is the rat's right hand. That's the right lung. This is the left lung. So trachea would branch into bronchi. We call it the right bronchus and the left bronchus. And then it gets even smaller into these little things called bronchioles, which will lead to the little air sacs known as alveoli. Okay, so alveoli, there's millions of them in the lungs. Their job is for gas exchange. So the alveoli are little air sacs that oxygen will come from the lung and go to the blood, and then from the blood carbon dioxide will come, and then the lung will exhale and get rid of that. Okay, so that's pretty much the path of respiration. One more time, we have nasal passages right here. We have oral cavity or mouth, pharynx, larynx right here, trachea, bronchi, 2 of them, right and left bronchus, into bronchioles, and eventually into alveoli that are in the lungs themselves. Okay, so there's a lung right there, and there's a lung on that side. They're the feathery looking structures. Okay, on this rat, just to give you a different perspective of look, okay, there's the trachea on this one, pretty good trachea, and you can see larynx up at the top like that. Okay, lungs on this one here. There's lots of lobes, like lungs there and there on either side of the heart. Okay, I'm going to use this one for the circulatory. First thing to see the circulatory, this is the thymus. Okay, we have to pick that up so that we can see. And if we pick it up, you see, look at these beautiful chambers. This is an atrium right here. That's known as the right atrium because it's the rat's right hand. That's one of the top chambers. These are receiving chambers. The left atrium is right here. Do you see me pick it up? Okay, I'll bring it in close so you can see. So that's right atrium right here, left atrium over here, and both of those are the receiving chambers. They're receiving blood, and then they will pass it to the ventricles. Okay, and the ventricles, I would just point to this. Okay, this is the bottom part of the heart. This would be right ventricle, left ventricle will be over here, but these are the pumping chambers. Their job is to pump the blood. If it's the right ventricle, it pumps it to the lungs. Left ventricle pumps it out to the body. Okay, other than that, what you need to know is this muscle right here. See this beautiful muscle? That muscle, I'm going to hold it so you can see, that separates, here it is here, it separates the thoracic cavity from the abdominal cavity. That muscle is skeletal muscle. That means you can control it, but usually you don't have to think about it. That's the one that aids in breathing. So it's going to get its stimulus from the amount of carbon dioxide that you have in the blood. The brain is going to sense that, send a message to it, and tell it to contract whenever you have a lot of carbon dioxide in the blood. Okay? All right, I believe that is it.